Cardiac amyloidosis is a condition that affects the heart, the nervous system, and often the GI tract. I'm specifically going to mention TTR, which is also known as ATTR cardiac amyloidosis. That's transthyretin. And basically the premise behind cardiac amyloid is that it's a condition where abnormal proteins form fibrils. And these fibrils deposit in places they shouldn't go, like the heart, the nervous system, and the GI tract. And by that, it can cause heart failure. There's a familial component and a wild type or senile component. And the familial component tends to occur all over the world, but specifically in the Caribbean population, in the Japanese population, and parts of Italy. So when we see these patients, we often do gene testing to detect if it's familial or wild type. The wild type, for some reason, is more common in the 80+ population, more common in males than females. And we see it often really in any type of individual that's older. It's an exciting time for ATTR amyloid because we actually have a lot more treatment options than we did even 10 years ago. So the premise of treatment options right now are really stabilizing or silencing these proteins. So when the protein is made in the liver and it misfolds, we want to stop the RNA or gene production of that protein, and that's called a silencer medication. The stabilizer medicines really help to prevent that misfolding from happening after the protein is made, and that process then stops any further progression of the disease into the cardiac tissue.